Hey everyone, and welcome to This Explainer. Today, we're cutting straight through the intense cultural noise surrounding Ozempic, Wegovy, and Mounjaro. We're going to look strictly at the data to separate medical fact from Hollywood fiction and really dig into the benefits, the risks, and the side effects of these drugs. Okay, let's start by just acknowledging the massive buzz. I mean, few medicines in recent history have generated as much public interest as these have. We're seeing users and headlines alike literally calling them an absolute, life-changing miracle. But, on the flip side of all that glowing praise, others are deeply worried about the very real, very serious side effects. So, what's the actual truth here? Well, today we're going to discuss exactly who should and really who shouldn't be using these medicines. Section 1. The science behind the hype. To really understand this, we need to look at the biology. These GLP-1 receptor agonists are basically biological mimics. They expertly manipulate your body's natural hormones, stepping in to boost your insulin secretion right when your blood glucose is running high, while simultaneously dialing back the release of glucagon. And then there's tirzepatide, which you probably know as Mounjaro. It actually takes things a step further. It acts as a double agonist by also stimulating GIP receptors, which significantly boosts its overall effectiveness. And all of this creates a pretty powerful biological domino effect right in your digestive tract. First off, they literally slow down how fast your stomach empties. That delayed emptying triggers this heightened, prolonged sense of fullness, which, as you can imagine, directly and effectively kills your appetite. Moving on to Section 2. Weight loss reality and expectations. Now, getting a prescription isn't just a free-for-all. The prescribing rules strictly differ depending on whether you're treating type 2 diabetes or engaging in weight management services. Plus, for certain patients, these medications are actually prescribed specifically for cardiovascular risk reduction. So these are carefully targeted medical treatments for chronic conditions. They're definitely not a casual quick fix. If you're considering taking these, you really have to internalize this. Real-world results vary wildly. The benefits only truly peak when they're actively combined with healthy eating and physical activity. And this is crucial. If you stop the medication without maintaining those new lifestyle changes, the weight almost always returns. All right, Section 3, common side effects and risks. Let's be completely honest here. Gastric distress is a very common day-to-day reality for a lot of users. We're talking nausea, vomiting, constipation, diarrhea, bloating, and excessive burping. It can be pretty intense. And that's exactly why doctors use a gradual dose escalation, starting you on a very low dose and slowly creeping it up, just to help your body build tolerance and minimize the shock to your system. Now, getting a bit more severe, there are some uncommon but highly serious conditions to watch out for. Pancreatitis can occur, and that usually presents as persistent vomiting and severe upper abdominal pain radiating right through to your back. If that happens, you need to stop the medication and seek urgent care immediately. Additionally, the rapid weight loss itself can actually trigger gallbladder disease, which presents as a fever, jaundice, and right-sided abdominal pain. There's also a highly specific boxed warning in some countries regarding medullary thyroid carcinoma. Interestingly enough, this is based on thyroid tumors that were observed during rodent studies. Because of that finding, having a pre-treatment specialist consultation is absolutely critical if you have a personal or family history of MEN2 or medullary thyroid carcinoma. Which brings us to Section 4, hidden warnings and drug interactions. Here's a startling thought that catches a lot of people off guard. Could your weight loss drug actually cause your oral birth control to fail? I know it sounds unbelievable, but it's actually a very real possibility. Because that delayed stomach emptying literally affects how your body absorbs oral medications. Or, if you happen to experience severe vomiting from a GLP-1, your birth control pill might not be fully absorbed. Because of this, you absolutely must use a backup barrier method, like condoms, for exactly 4 weeks after starting tirzepatide, and then for another 4 weeks after every single dose increase. Otherwise, you might actually need to switch to a non-oral contraceptive entirely. Furthermore, because food just stays in your stomach so much longer, you absolutely must alert your surgical and anesthetic teams before any operations. This is to avoid really dangerous complications, like aspiration while you're under anesthesia. And regarding family planning, women must stop taking these medications well before a planned conception, as they generally should be avoided completely during pregnancy. Finally, Section 5, myths, red flags, and safety. Despite what you might hear scrolling through social media, using these drugs isn't cheating. It is a totally valid medical treatment for a chronic disease.
Also, massive weight loss is absolutely not a guarantee for everyone. You can't just eat whatever you want and expect magic to happen. And as we warned earlier, the weight will return if you just abandon your healthy habits once you stop the injections.
It's also super important to remember these medications are simply not for everyone. Patients with type 1 diabetes, severe gastrointestinal disease, or previous severe pancreatitis require highly individualized specialist care, or honestly, they should just avoid these medications entirely. If you're taking these or you know someone who is, recognizing the warning signs could literally save a trip to the ER. You need to seek urgent medical care if you develop severe abdominal pain, persistent vomiting, signs of dehydration, jaundice, or symptoms of diabetic ketoacidosis, which is particularly dangerous if you also happen to be taking an SGLT2 inhibitor. Ultimately, what we're looking at here are incredibly powerful medical tools, not magic wands that just solve everything overnight. Knowing the biological reality, the potential side effects, and the rigorous effort required, are you truly prepared for the complete lifestyle shift these tools demand?